admit the fact that I never thought that something like this would happen to me. Dealing with a pandemic while being an occupational therapy student was not one of the things that I feared bees. No, but here we are worrying about a pandemic, getting sick and dying. Becoming an occupational therapist has always been something that I've wanted to do. I've worked hard to get to where I am. But because of this COVID-19 pandemic, all of us occupational therapy students we've either been sent home or we have to participate in Zoom classes. My main concern is my level 1 fieldwork. Level 1 fieldwork is about hands-on experience. All the fieldwork experience in hospitals, schools, long-term care facilities, they've all mostly been canceled for fear of the coronavirus. So it's terrifying to think that we set these goals to accomplish them by a certain deadline, and now they're getting pushed back because we can't attend fieldwork.
I'm a quadriplegic, and I rely on a personal assistant to help me with transfers and other activities around the house in order to be independent and be able to work and engage in the community. It terrifies me to think that if my personal care assistant doesn't come, that I'll be stuck in bed and unable to do anything. I won't be able to work. I won't be able to go to the grocery store. I won't be able to do any of the things that I need to do. I really need to make sure that the personal care assistants are available. During COVID-19, the crisis is even more fearful because I don't know if they show up. Are they going to be safe to show up? Are they going to get called away because they have to take care of their kids? Are they going to have personal protection equipment? I just don't know.
I have a spinal cord injury, and I'm a board member with the Iowa chapter of United Spinal Association. The personal care attendant and DSP shortage has had devastating effects across the country. One of our members couldn't take a shower for over 13 days because she didn't have enough personal care assistance, and another one is trying to heal from a bed sore and has gone without care for 2 days. When I talk with other leaders in the disability community in other states, they all have similar stories to tell.
I am a mom of a child with special needs. During this pandemic, I had to work from home, homeschool my child, take care of the household, and try to give my child the structure that she needs. She needs a lot of my attention, and her self-destructive behavior just doesn't allow me to get things done. I wish I had some help for her. She needs the structure that I just can't provide.
Our project addresses the needs of these community-dwelling people with disabilities and older adults and children with disabilities who are all in crisis because the COVID-19 pandemic has left them without the reliable assistance they need. We will match them with occupational therapy students who are also in crisis with the help of our partners, national, state, and local disability advocacy organizations, and academic occupational therapy programs from around the country. The occupational therapy students, and in some cases, occupational therapy practitioners who've been laid off because of the COVID pandemic, will provide services and supports in the personal care assistant direct support professional roles. This will promote independent living and help community-dwelling people with disabilities and older adults avoid long-term care facilities with their current high COVID-19 related mortality rates. Further, this will contribute to the culture of health by facilitating the students learning about self-directed care from the perspective of the person for whom they provide community-based services, thus seeing people as people first, not patients, while at the same time meeting their own crisis need for a level 1 field replacement.